Today, we're talking about long COVID symptoms, possible causes, how many people might have it, and more. I'm very excited to be able to talk today to Dr. Jason Maley. He is director of Beth Israel Deaconess Medical Center's Critical Illness and COVID 19 Survivorship program and an instructor in medicine at the Harvard Medical School. Dr. Maley, thank you so much for your time today.
Thanks so much for having me.
So we hear a lot about people suffering from long COVID, but not a lot about what causes it or how to treat it. So first, would you tell us a little bit about your work? What do you guys do at your program, and how do you see patients?
Sure. So our program started initially early in the pandemic when we began to see people mostly leaving the intensive care unit and the hospital with COVID and having persistent symptoms after that. And since then shifted to the majority of our patients being patients who had mild COVID initially. They weren't in the hospital, but now they've had these persistent symptoms like we'll talk about that we're describing as long COVID or these post-acute symptoms of COVID. We see patients initially, either myself or our nurse coordinator, to understand what's going on head to toe, because there's so much people are experiencing. It may be confusion and difficulty thinking, it may be shortness of breath, racing heart rate, unexplained pains or other symptoms. And so we try to understand all the symptoms that are going on. And then we have a team of physicians, social workers, therapists, occupational and physical therapists, and others involved who will then help care for these patients depending on how they're affected. And we also work on research simultaneously.
So let's go at this first from the patient's experience, and then I'll come back and ask you about the science of it. I've read that people with long COVID can experience more than 200 different symptoms across 10 groups of organ systems. That's a lot to process. Can you help us bucket this in some way, or tell us how do you think about the kinds of symptoms that present?
Most people have kind of a core group of symptoms that we see most often, which include feeling a severe fatigue that is, in some people, debilitating so that they have difficulty with just daily functioning. In others, they're able to get out of the house, but then they, after, say, going shopping, they have to lay down for several hours to rest. And these are people who are healthy. Many were athletes. They were young and very active before this. So it's a huge change, that type of fatigue. Along with the fatigue, the most common other symptoms are feeling breathing or chest discomfort, feeling short of breath, difficulty catching breath, walking around, feeling changes in your thinking or memory. People describe easily losing train of thought, walking into a room and forgetting why you went in, or being in the middle of a conversation and losing that train of thought, which we've all experienced, but doing it much more frequently than they'd ever experienced before, and having difficulty returning to work because of that. So I would say fatigue, breathing, and respiratory issues, and these changes in thinking and memory, sometimes called brain fog, are the most common three that we're seeing. Another thing along with that is people feeling as they walk around that their heart is racing, their heart goes much faster than they would expect. And then from there are a whole host of things from head to toe, persistent changes in smell and taste, not recovering smell, or having unusual smells that aren't there, having difficulty with eating and digestion, having numbness or burning or tingling in the hands and feet, changes in the skin. So many things in that list you mentioned, which could be almost every symptom you could imagine we've had patients describing. But that core group of symptoms is what people are most commonly affected by, and really what is most detrimental to people carrying out their lives at home or at work.
I know when you go through those symptoms, a lot of people go through their mind and they're like, I have that, I have that, I have that. Like,
Yeah.
it's just, so I want to help people feel sort of clear on this. Can I ask some sort of, I don't want to say rapid fire, but simple questions?
Yes.
How much longer after getting COVID might these symptoms manifest? Do they happen instantly? Could it happen 2 weeks or 2 months later?
Yes. So that's a great question. When people are sick with COVID or any virus, they may feel some of these symptoms. And so I would say we begin to think about them as lingering symptoms that could represent long COVID once you're, say, 4 to 8 weeks after having the infection. So it's common to feel this way, perhaps, when you have the infection initially. but those should resolve with time and you should recover and you should get back to feeling normal. And it may be not night and day. One day you feel these, the next day you're better, but gradually each week after you have the infection, you should feel I'm starting to recover. So most of the patients we see are between 1 to 3 months after having the infection, they begin to recognize that these things haven't gotten better.
Now, you said earlier that you'll see it in patients who had mild illness, but can it happen whether you've had mild, moderate, or severe?
It can. It can happen regardless of how severe the initial illness is. That's one of the mysteries. And I think what's caught people's attention is if you were in an ICU on life support and you survived, we'd expect it will be challenging. You'll be weak, you'll be fatigued. You may have other changes as a result of being that sick. But what was really striking and catching attention with long COVID were people who were healthy. They were sick for a few days, didn't feel that bad when they were sick. And then over the subsequent months, they have these severe persistent symptoms. And so that's what's really gotten, I think, the most attention and the most, hopefully, funding and research to answer this.
How severe is long COVID itself? Can people have a mild or severe case of long COVID? Does it present in one way?
It can range in severity. I would say most people that we see, they have started on their own to recover. They've begun to do things around the house. Many have returned to work, but they notice they're not able to be as effective at work. Their thinking has changed. They have to take frequent breaks. So that would be on the milder spectrum. We do meet people who haven't been able to return to work and can barely function around the home as well.
You've mentioned that a few times, and it's so important to underscore because, I'm in the news business and we cover the great resignation a lot. And it's covered like all these people throwing themselves free from the shackles of a job they don't want.
Right.
But what you're saying, and I'm hearing this increasingly, is a part of that might be folks suffering from long COVID.
That's possible. Yeah, that's a good point that there's a large number of people we estimate who are experiencing these persistent symptoms. Most people are very hesitant to return to work when they're experiencing them because other people notice it. They think their performance is poor. They're worried that they'll be blamed for that poor performance. And so a lot of our patients do take time off from work or haven't been able to return.
Are there any markers that make a person more likely to get long COVID, either pre-existing conditions or if you have a mild case, it's more likely than a severe case, or anything you're seeing that's consistent?
There was a recent study that pointed to a few markers. I would say, and I'll talk about those, for the most part, there's no clear, consistent pattern across all patients. I would say, unfortunately, anyone is at risk, even young, healthy people. This study found people who have diabetes, people who had high levels of the virus in their blood and had a reactivation of a certain type of virus that causes the disease mono, Epstein-Barr virus, as well as a few other kind of immune system tests could point to those at most risk of having long COVID. But overall, it could affect anyone, unfortunately.
Okay, let's look at the science now. I know that we're all still just learning about this. But that said, there seem to be a few prevailing theories about what could cause long COVID. I've read that there's a theory about your own immune system attacking you. There's another about blood clots. What are your theories about the forces driving long COVID?
At this point, I think the strongest theories are around the immune system and how the immune system is not recovering the way you would normally expect after a virus. It should create a response to someone having an infection and then dull back down so that when you're living your normal life, it's not active. You don't have what we would term inflammation, which would be the immune system actively doing things within your body. Studies, even going back to last year, saw that after this virus, the immune system was persistently active for much longer than you would expect. And so we think inflammation in the immune system is, broadly speaking, is the most likely clue to this, and an abnormal response of the immune system to having the virus and potentially continuing to injure the body because of that.
Can you help us understand the role of blood clots in all this, or is it not relevant?
So there's been, even from the very beginning of COVID, interest in first understanding, were patients clotting, having blood clots more than expected, because that was something people observed. And there were studies looking at if blood thinners could help those patients who were sick at the time of having COVID. Those didn't pan out as being helpful. It didn't show that those blood thinners helped patients. Then with long COVID, there's been a new kind of renewed interest in seeing, could very small clots, sometimes people call micro clots, play a role? I think right now the evidence for that is very limited and very preliminary. And my suspicion is if those were found, it would more likely relate to a consequence of the abnormal immune response than the clots themselves necessarily explaining the whole picture. I feel from the patterns of symptoms, there's too much going on for just clots to explain everything that we're seeing. It seems that there's an immune system injury that goes beyond that.
I'm also getting questions about these recent studies showing that COVID somehow causes fat cells to miscommunicate and organs to sort of go haywire in some way on themselves. Is that a piece of this?
I think those are all kind of little clues to try to get at what is changing within the body. One of the challenges is whenever someone has an infection and we begin to measure blood tests, we really need to know what is, since we haven't looked in this detail at most people ever recovering from a virus, what's normal recovery? How do you compare these people to other people who don't have long COVID but had the virus? That's what we're trying to get at, is really carefully comparing what is changing in the body of someone who has long COVID and had COVID versus someone who had COVID and recovered fully. And so far, at least, it looks like the immune system and abnormal activation of the immune system is the best clue to that difference.
Have you seen people who have long COVID for a few months or even a year and then recover?
Yes. So we definitely see, and I think that's something sometimes lost in stories of long COVID. We see people very debilitated for 6+ months. And by 12 months, they feel 95% back to normal. And we've seen them recover and feel great from severe symptoms. We unfortunately see people who have very prolonged symptoms and haven't recovered, but I would say the majority of the patients we see are continuing to have improvement as we follow them over time. And so at least that's something positive and reassuring.
Okay, I want to ask you about something you tweeted about recently regarding lungs. And I want to tell anybody listening, this is sort of upsetting. And if you easily get triggered, you might want to fast forward for the next 3 minutes. So I want to ask you about one example of things that we're seeing. On Twitter, you recently shared data on what MRI scans show in some COVID patients who are never hospitalized. And to quote, you posted an image of lungs that, quote, light up on an MRI scan. And what we see is described as inflammation, autoimmunity, and potential viral reservoirs in maybe GI or brain. The author wrote that these people's lungs transferred gases into the bloodstream abnormally. Gosh, that seems alarming and weird. That there's damage from long COVID that's not visible on a CT scan, but is on this MRI. Would you explain the significance of this?
Yes. So what we're trying to understand with that, and what researchers have been looking at, are this group of people, a large group, who feel short of breath after having COVID. They had the virus, it was mild, but then they have difficulty breathing. And so we've spent a lot of time trying to get at what is changed in the lungs that could explain this. And one group of people are those who feel short of breath. They may have a CAT scan, which is just a 3D X-ray of the lungs that doesn't show scarring. But they may have lung breathing tests, pulmonary function tests, that do show something has changed in the lungs. And then we're left with these conflicting pieces of information. And this type of MRI that's being used in the UK is only used for research, but it has given clues that now on the picture itself, we can see those changes in the lungs. And so I think more than anything, it validates our suspicion, and also validates the many patients who are being told, we're not seeing anything wrong on your X-ray or lungs. I don't know why you're short of breath, and kind of getting the message or the vibe from healthcare providers that they don't believe them. And so it's good validation to what we're suspecting.
That's the plot. It's very like, this is real, it's happening, but we're still solving for why and what to do about it.
Yes. And I would point out also that most people I would not expect them to have that finding, because when we do lung function tests, very detailed tests of gas exchange, which is just air moving from the atmosphere into your blood through your lungs, we don't find that those are abnormal. So I think if you have reassuring lung function tests, we wouldn't expect to find abnormalities like scarring in the lungs.
It's not the case that most people with long COVID have scarring in the lungs.
Right. I think even the studies that have really carefully followed people doing these lung function tests have found that it's a minority. It's more than you would expect. In some, it's up to a third of people, but those are still smaller early studies. And I would say the vast majority of people are recovering from COVID, likely without permanent injury to their lungs.
That's so helpful to know, because you check by the headlines, it would seem that that's not the case. So this is great to hear. You did an interview a year ago, April, and at the time you said you were seeing long COVID a lot in younger people. Is that still the case? And if so, what do you see in terms of age, and what's your theory on this?
Yes, we see long COVID across all age spectrums, so it certainly could affect any age. And early on, my suspicion was that long COVID groups were organizing first in social media, and probably younger people were most engaged in searching for answers. And probably that led them to come to these long COVID clinics that were just emerging. So it's possible we may learn there's something about the immune system or the response of young people to the virus that could make them more likely. But it's also very possible it's just a phenomenon of who's seeking care at clinics, who's joining these support groups within social media. And so we tend to see a younger age group.
That brings to mind something I've wondered about. We're finding all this because the whole world is looking at one ailment at the same time. But I wonder, would we have found long Epstein-Barr if the whole world looked at long Epstein-Barr or long other virus if there were this much focus? Is this necessarily a unique feature of COVID or not, or possibly not?
That's a great question. The pre-pandemic data looking at Epstein-Barr and mono or flu or other viruses have found similar syndromes to long COVID. People who have something called ME/CFS, myalgic encephalomyelitis chronic fatigue syndrome, which is just a kind of big umbrella term for people who either for a known reason like a virus, or sometimes they don't know what the original cause was, feel this debilitating fatigue. They get physical illness symptoms after activity and aren't able to function. So it's been, even for hundreds of years, actually been written about having similar syndromes after infections. But like you pointed out, it's never reached this level of recognition, probably because of the scale of the pandemic. And there may be unique parts to this virus itself, but we certainly know other viruses and infections have caused similar syndromes. And I think this is for those people who haven't been recognized prior to long COVID and have experienced other post-acute infectious syndromes, bringing more information to them, validating their experience. They have kind of gone unheard for a long time. And just the sheer volume of people experiencing long COVID is getting attention in a way that I think these people prior to the pandemic had not been able to get that much attention put towards this issue.
I think in particular of women, because women seems disproportionately suffered chronic fatigue. And when I was growing up, I knew of all these older women who had chronic fatigue, and everybody said, oh, they're crazy, they're neurotic, they're complainers. And now it's Epstein-Barr, and it's a known, it's validated. Do you think this long COVID research could actually help with these other lingering ailments too?
I think so. I'm hopeful that first, just the similarities between the two probably suggest there's a common change in the body that explains why people feel this way after COVID, as well as other illnesses. And so if we find treatments, I'd be hopeful those treatments should also help other post-acute infectious illnesses. And that's really what we're trying to get to the bottom of, is what is truly changing in the body so we can figure out what's the best treatment, because otherwise it's kind of trial and error. And I haven't seen anything in terms of a medication that clearly is solving the underlying problem of long COVID yet.
So let's get to that. What if any treatments exist for people with long COVID. And does anything like getting the IV, the antibody, monoclonal antibody like sotrovimab help you avoid it?
Yeah, so from kind of starting from the beginning, definitely the best thing for preventing long COVID is having very good protection against it, which vaccines is actually, there's a fair amount of research looking at the role of vaccines in preventing long COVID symptoms, or among people with long COVID who get vaccinated, what does that do in terms of their symptoms? So far, some of the early studies have suggested that people who are vaccinated and unfortunately get infected with COVID are much less likely to develop long COVID than people who are unvaccinated and get infected with COVID. So having that protection initially, probably to quickly clear the virus, reduces the likelihood of having long COVID. Beyond that, we don't know yet if people who got these newer treatments will be also less likely to develop long COVID because they got early treatment for it. And we don't know if later on, if you got COVID 2 years ago and you still have symptoms, if one of those treatments would be helpful because one, they're just so limited in supply. It's not something that's approved or would really be available to try yet. But also, it seems most likely that it's the continued abnormal immune response, and that may not be solved by giving a treatment that would treat the virus itself rather than the resulting immune response. But it's certainly still open as it's an open question and we don't know yet.
You said that there's some evidence that people who are vaccinated and then get COVID are less likely to develop long COVID.
That's right.
Is it also correct that people who have had COVID and have long COVID benefit from getting a booster or the vaccine after they've already gotten the long COVID, or no?
So that's something that's being researched right now. It kind of came of just anecdote of people sharing in these long COVID groups as vaccines initially became available. This is how I felt after the vaccine. And a fair proportion were saying, I got the vaccine and it improved a lot of my symptoms. And so we were hopeful that there was something about the vaccine, whether affecting the virus itself if it persisted or changing the immune response, that was helping people. I would say it's still my experience that most people feel better after the vaccine or no different. Some people do have a setback in their symptoms. They feel their symptoms really were set back by having a booster, but we don't know in any one person. So we do still recommend that patients get the vaccine unless they've had a severe reaction to it.
So let me ask you a little bit about the research you guys are doing in particular. What are your studies, and is it very multidisciplinary?
Yes, it's definitely very multidisciplinary because there are so many things affected head to toe, specialists in all different areas of the body. Right now, the National Institutes of Health, the NIH, has launched this study called Recover, which is centers throughout the United States who are trying to collect information over many years is the plan from patients who are experiencing long COVID, as well as people who have COVID but recovered, and people who have never had COVID. So we can compare what's happening in the immune system, what's happening within their bodies to understand ultimately what's causing long COVID. So that's, I think, the most exciting recent study. And then simultaneously, there are some smaller studies looking at, are there specific types of therapies that will help COVID? We're doing a study on a specific type of breathing exercise for people who have shortness of breath or have other persistent symptoms. And if that can improve people's sensations of breathing and improve their exercise and their quality of life. And hopefully there will be more drug treatment trials coming about. I know there are several that are in very early stages looking at ways to improve fatigue or other symptoms of long COVID. And hopefully in the coming months, those will make progress and become more widely available.
Hmm. So there's both behavioral interventions you're looking at and drug interventions that are sort of in the works out there.
Yes, I would say, and kind of rehabilitation focused interventions.
What would you say to folks who are suffering from long COVID right now and don't know where to turn or what to do. I hear reports that people can't either aren't believed or don't know where to go or can't get into programs that deal with long COVID. What advice would you give them?
It's a really tough position to be in because first there's the common experience of not being believed. And then even within our long COVID clinics and clinics I know with colleagues around the country, every clinic is so strained that wait times are getting longer because this is becoming more common and we expect there will be more people with it. So I think the most important things to do are definitely to seek care with a doctor, whether it's a primary care doctor or a specialist that you really are comfortable with and will partner with you and believes that there's no need to prove these symptoms. You're having real symptoms and will try things that may be out of their comfort zone to try to see if we can get you feeling better. There are listings of long COVID clinics online. The website Survivor CORPS. They have a listing with a map of long COVID clinics, so that at least tells you what's out there in terms of options. And I would kind of call many in your area to see, because the wait times, unfortunately, are so long because of how busy they are. You may find one that's much easier than another, depending on wait times. And I would just try to get in to one of those as soon as you can.
And what I hear you saying is try to advocate for yourself. In other words, if you have a doctor who doesn't seem to be supporting you, or if you don't feel supported, you're probably not being supported. So keep going and seek out another voice.
Yes, definitely. I think you shouldn't hesitate to move to a different doctor or find someone who you really trust and will work with you, because that's the most helpful thing, especially because there's unfortunately no straightforward treatment for this. But the patients we're seeing are getting better, and they're getting better with treatments that help each of their symptoms, that support their physical recovery, their emotional recovery, their cognition, and their thinking. And so there is help out there. It's a matter of kind of finding the right person who's willing to work with you and who believes you. And hopefully, with this and with a lot of the publicity, that's becoming less and less of an issue, but I know it still is a problem.
Well, Dr. Maley, thank you for being one of the people who listens and is making strides on this. Thanks for your work and for your time today.
Thanks so much for having me.